All right, Mrs. James, I'm sorry we're meeting under such circumstances, and I know how disappointed you are. So I just wanted to discuss with you about your concerns and come up with a plan.
Yeah, you're right. I'm extremely disappointed. Well, I was here. I got my treatment done, and look what you did to me. Now I have a baby mouth.
I'm so sorry.
I can't open my mouth, and
Yeah.
I have the swelling, and I can't eat properly. And this is not something I expected. It has never happened before.
Wow.
What did you do?
Well, I hear you, Mrs. James. I know this is not something you and I were hoping, right? So, see, again, it's very unusual, but I'm not sure if we had a discussion about some similar complications happening in our previous appointment.
Something like this. I've had so many fillings. Nothing happened ever like this before. This is the first time I'm having so much swelling and I can't even open my mouth to eat anything.
And look, these are valid concerns that you have, Mrs. James. If I were you, I would have felt the same way. But would it be okay if I walk you through what I think possibly might have happened in your case?
Yeah, that's exactly why I'm here. I want to see like why what is happening and why it's happening.
All right. So, Mrs. James, do you remember last week when we were giving you injection at the back of your mouth when we were trying to fill this tooth, right?
Yeah.
I gave you a needle at the back.
Yeah.
So we call this as inferior alveolar nerve block. It's an injection technique that we use when we are trying to numb those teeth in the lower jaw. So as part of this technique, even though, if you remember, I was touching at the back of your mouth, there's some landmarks that I was trying to confirm and check, which can vary from person to person. So there is a possibility that I may have nicked one of the blood vessels that was lying very close to this nerve that I was trying to numb. And I'm very sorry about that.
Oh my. So right. So does this mean that every time I'm gonna get treatment, something like this is gonna happen?
Well, not necessarily. Look, again, it's a very rare complication with this technique that I use because with this, we're giving you a very long needle at the back of your mouth. Not necessarily you might have it again, but I'm sorry if it happened with me, Mrs. James. So going back, so that swelling that you see, there's a blood pooling around that area, as I mentioned, it's a hematoma. And that limitation in mouth opening that you're experiencing, it's probably because of the blood which is irritating the muscles around that area that we call as myospasm. And we call that inability as trismus. And I did measure, and I do agree, it's quite restricted. It's about 20 millimeter.
Yes, I can't eat properly.
I'm so sorry.
I can't do my daily chores, and I feel really hungry.
Oh, I'm so sorry about that. But look, how about we work together and we can find a solution to that? Does that sound like a good plan?
How are you going to help me with my pain and the swelling that's coming on? Is it going to get worse?
Well, it can, yes, but if we work together, we can make it better. So just going back to the basics. So you have swelling and you have limitation in mouth opening. So
Correct.
Which one worries you the most so that I can start discuss about that?
I can't open my mouth. It's a baby mouth now. My child is opening more than me.
All right.
So, yeah.
So see, with trismus, like I said, it's because of the blood which is irritating your muscles. But at this point of time, we don't know where that blood is, if it is inside or outside the muscle. Okay. But it also could be because of the injection that I've given you. So with or without the treatment, trismus might take sometimes 6 weeks or a bit longer to go away.
Wow.
Yeah, but it's important.
Why does it take so long?
Well, Mrs. James, it's like your muscle sprain. I don't know if you had any sprain in your ankles.
Yeah.
Sometimes anything to do with your muscles, it does take a bit of a while. But it's important we treat it because if left untreated, your muscles, eventually you'll have permanent scarring that we call fibrosis.
Oh, wow. I did not know that.
Well,
So
that's something.
how can you help me today?
So, see, there's a few things we have to think about it. See, now that your muscles are tired, they need a bit of time to recover. So the first thing I would suggest is that we don't put excessive forces of your muscles. So maybe trying a soft diet. So what have you been eating lately?
Well, to be honest, I'm just grinding and having smoothies, grinding my food up, and that's all I could have. I had a banana in the morning.
Well, bananas are nutritious.
Yeah.
Well, again, soft diet, even if you have anything, We can chop it down bite size so that you're not excessively biting. At the same time, your muscles need a bit of exercise. Remember we spoke about we don't want permanent scarring. So I can show you some exercise we could try, like opening, closing, and moving your jaw sideways. Yeah, I've got some brochures I can show you. You can try at home.
Is there something that would help me with the pain as well?
Did you try taking anything?
I just took some Panadol. It didn't do much.
And how have you been taking that?
Well, I took one yesterday and one at night.
Okay, so see, Panadol are good in terms of pain relief, Mrs. James, but how about we add ibuprofen to that, which is anti-inflammatory, because anti-inflammatory means your body's reacting to it, so it will calm that down. So 400 milligram if you take it every 6 to 8 hourly, and we use that Panadol alongside that. 1000 milligram if you can take it 4 to 6 hourly would be ideal. And let's see how we go in the next 2 days. I'm quite interested to see how it's going to turn out, because if it gets better, well and good. If not, then we can look at other options, because I'm also worried about the swelling on your face, Mrs. James.
So what other options are there?
So see, if I'm worried about this trismus that is there, could be because of the bleeding. Remember we had a discussion about it. So I'm more worried about that.